Wellness Wednesday with Dr. Bradley Meyer at the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Dave, good morning. Good morning, everybody. Happy fourth week.
Yes, indeed.
Beautiful
Now,
day.
listen, before we get rolling here today, I do want to make sure, because even though we're getting days away from the disaster that struck Northwest Iowa with the flooding, do want to make sure that folks know that there is some available help at Okoboji Wellness Clinic.
Yeah, absolutely. Again, going through this, it's been a traumatic experience, and there's layers to that, and it goes from just kind of the shock part of it, anger, and it is a process. So I encourage you to reach out to your local help, to your clergy, to whoever it may be that to work through, talk through that. We do, of course, have availability here at the clinic, complimentary brain tap, it's brain exercise, and it's incredible for kind of just relaxing the mind and kind of helping work through anxiety, stress, and trauma. It's using binaural beats, blue and red light therapy, and each session's about 15 to 20 minutes. So we are offering that up complimentary for those afflicted by the floods to come on and put your feet up here and take 30 to 60 minutes for yourself in the clinic and get some of this treatment. The other part of it is working with Dr. Bandy Brock. Incredible. Comes here from Sioux Falls on Thursdays. He is a grief trauma loss specialist, and who doesn't have grief trauma loss in their life, especially over the course of the last 4 to 6 weeks. So incredible resources. If you want to learn more, just give our clinic a call, and we can get you all signed up.
All right. Now, today we're going to talk about blood sugar.
Absolutely. Always an area of interest to me. When I was going through medical school, I had a mentor that he actually was a doctor, a family doc that had diabetes. And so that became my passion through him. And it can be such a hard and difficult disease. What's happening with it is your blood sugar increases in your body, and your insulin, you become insulin resistant, essentially. The insulin, what that does, is produced by your pancreas, which is an organ in your body, to shuttle sugar or glucose into your cells. That's what the fuel to make energy. If that sugar is staying on the outside of the cells and getting stuck there, then the sugar rises and it causes damage. So that's what happens over time, and it causes inflammation, so many problems. And traditionally, it can, of course, I always used to, words are so powerful. One of the things I always, now that I've got my own clinic here, I get to relabel things. I don't like to necessarily say diabetes anymore. I like to say insulin resistance or some elevated blood sugar, because in a sense, if you say I am a diabetic, what is that saying about yourself? It's like a diabetes is a disease. So you're like, well, I am a diabetic. I am identifying as a disease. So no, you're not a disease. Let's move away from that. Let's work on what's causing that blood sugar to elevate. And so many folks just think that yep, I just got to go on my metformin or my insulin, and there's really not much else out there. Once I have it, and there's no turning back. And that used to be kind of my thought process too. It was the insurance companies would always say, well, the patients would say, I don't want that in my chart because it affects my insurance, my premiums, and all that. And I can understand that, because they would tell me, like, oh yeah, once you have that diagnosis, it's with you for life. The fact is, you can reverse it in many cases, and there's work to be done with it from a metabolic perspective, from what you're doing lifestyle-wise, what you're to eat, and activity level-wise, what herbals, what supplements you're on. But speaking of Spencer, had an incredible story. This gentleman that came in, and his doc was like, well, your blood your labs don't look very good. We need to increase your blood pressure medicine. We need to get you on some blood sugar medicine. And this gentleman, probably in his 50s, came here and he's like, I don't want to do that. Can I try something different? And his level, we measure an A1C, and when that's glycosylated hemoglobin, so that's the sugar sticking to hemoglobin, which carries oxygen in the body. Think of elevated blood sugar almost like hardening rock candy. When it's high, it's sticking to that tissue and it's inflaming that tissue. So that's why it's so detrimental, why we want it low for brain health, to heart health, to every part of your body's health. So he came in, and I'll be honest, his ferritin level, which is an acute phase reactant to blood test, was 1,500. That's quite high. His A1C, or average blood sugar, was 7.6. Normal is less than 5.5. And so he's like, I just want to work on lifestyle and get going on some things that are going to reduce inflammation. So that's exactly what we incorporated on that journey together. We didn't even implement hyperbarics with him. Hyperbarics are fantastic for speeding up metabolism, lowering blood sugar. He's like, nope, I just want to hit the lifestyle, and I want to work on the proper supplements to kind of help get my body back into balance. And it was an incredible, when he came in, he had no energy. Again, the typical things: no energy, brain fog, body aches, joint pain. He felt like his physical stamina was not what it used to be. So in short, he felt not good, rotten. And you roll down about 3 to 4 months. Every time he'd come in, every month or two, he'd surprise me. He's like, I'm seeing little improvements. I'm getting more energy. And what he did, we found that gluten and dairy were factors for him inflaming him, which we can see in many cases with folks that have elevated blood sugars. So he was diligent about cutting those things out, and then he worked with Molly Avery, our functional nutritionist, to learn about the microbiome, the gut. How do we get that back into shape so that our blood sugars go down from a perspective of microbiome as well? But I got him on different supplements that are very beneficial to inhibiting gluconeogenesis, which is the making of blood sugar in the liver, detoxing the liver, getting the whole pathways moving, giving the body the cofactors, the vitamins, minerals it needs to do what it wants to do. So the body needs to make insulin to get rid of sugar. You need to have the appropriate cofactors, the vitamins, minerals, all those things to make that happen. You can't just make it out of thin air. And so that's what we did. We started working on the nutrition and these vitamin supplementation and lifestyle choices and cutting out the gluten and the dairy. When he came in this summer, I'm like, you are an incredible story, because he went from a 7.6 to a 5.5 on his A1C.
Wow.
That was without a prescription.
That's
so that
awesome.
went from it was incredible, from a full diagnosis of quote unquote diabetes or elevated blood sugar to normal blood sugar. And so his ferritin level went from 1,500 to 500, which is that acute phase reactant. So we worked on detoxing his liver. So he's like, my energy is so much better, my brain fog, my pain, all those things. He was just getting gummed up, his system, and with all of the toxins, and so just so powerful. So if you're so moved, like this gentleman was, it was an honor to walk alongside him in this. He did all the hard work. I just gave him some education and some recommendations, but to see something that typically, 3 years ago, 4 years ago, when I was practicing a lot of nothing but traditional medicine, I wouldn't have spent enough time talking to him about this other way. And I would have been, prescribing him probably 2 or 3 blood sugar pills, and really not giving him the hope that there is a possibility to turn this around if you want to. So just that was just incredible story on blood sugar that I thought I would share. And again, another example of disease. Disease is inflammation. How do we decrease inflammation? How do we get the body back into balance? And in his way, it was tremendously successful.
All right, well, we're out of time here. One thing I think we have learned is we personally can play a hand in our own recovery, and it doesn't necessarily, although, listen, there's a place for pharmaceuticals. There can be a Band-Aid there. But like this story just proves that it doesn't necessarily have to be a pharmaceutical that can turn things around. There are big things, and one of the reasons to visit with Dr. Meyer is, like, when it comes to supplements, they are not all created equal.
Absolutely, and it's the absorption is key. What's preventing absorption in the body? So we want to figure that out. But are they third-party tested? Are they quality? Are they organic? Are they concentrated? There's so many factors that a lot of times people end up just with expensive urine because it's just going right through them. It's not absorbing. So yes, we can help you determine what is a good supplement for you. A lot of times folks will go on the internet, kind of surf, say, hey, that Dr. Gundry, and he has a lot of good things to say. He's selling something, somebody else is selling something else, but there's kind of a way, there's an art to putting it all together and getting folks on supplements that cover a lot of different bases. And so it's like, it'd be nice if we had one supplement that covered 4 or 5 bases instead of just gave you zinc or selenium, that kind of thing. We want to cover a lot of bases, so that's what we want to do. We want the good stuff. We want good absorption, and we can help you walk through that and create a game plan.
All right, so as we approach Independence Day here, let's get a little independence on our own health and get free from those days where we just are surviving and go out and live. And Dr. Meyer, how can folks come to visit with you and make that happen?
Yeah, it's 712-339-6024. Call us for a discovery call, which is complimentary, 15-minute call with me to discuss the options with your story, with your health concerns. And then we can get you plugged into the system, plugged into our clinic here. And I won't say the system because we're anything but a system. We are like your living room. So we do things differently here. But give us a call, and we'll explain how exactly your story can fit into what we can apply to walk you down that wellness walk. We are at 3305 Berquist Avenue in Spirit Lake, just next to Highway 71. And we're always happy to welcome you if you stop in and say, hey, I'd just like to walk through the place and see what it's all about. Look at those hyperbaric chambers, and have a peek at different modalities. Ask your questions. We have an incredible team, folks that come from far and wide, from different parts of the country. That's the feedback we always get is we felt so welcomed. We felt like that wasn't your traditional medical facility. We felt it was like home. And so I've got an incredible team, blessed by an incredible team. We are here to welcome you and walk with you in getting you thriving and enjoying your life, living it to the fullest, Dave.
Very good. Love it. Dr. Meyer, thank you so much. Happy Independence Day to you, your family, all your staff, and we'll chat soon.
Sounds great, Dave.
Thank you very much.
Bye-bye.
Dr. Bradley Meyer of the Okoboji Wellness Clinic. Again, you can find them online at okobojiwellnessclinic.com.